Hi class, this lecture is on week 12 pharmacology review. The lecture is on biological agents and immune stimulants. All right, so let's review the PowerPoint on the side and then look at this area. So you see, we're going to talk about biologic immune modulators, all right? So what are immune modulators? Something that will increase and strengthen your immunity to fight infections, right? So what are your fighting cells? Your WBC or white blood cells are your fighting cells in your body. So anything that will improve their function or strengthen them or increase the amount of WBCs or fighting cells in your body are called as immune modulators. Right? So immune modulators are used to modify the action of immune system. There's two types. One is immune stimulants that energizes the immune system, which is exhausted from fighting a prolonged invasion. So let's say there was infection and there's not enough WBC to fight it, then we give them some immune stimulants. Also, they're used when immune system needs help in fighting a specific pathogen or cancer cells. Now, immune stimulants, so sometimes like someone's sick and then we say, strengthen your immunity, like take your vitamin C. There are some natural immune stimulants, like we say, like fresh fruits, fresh vegetables are very high in vitamin C. And then we'd say, eat fresh fruits, fresh vegetables. There's vitamin C tablets that are available that helps. What do? They help our immune system, right? There are times when we tell, your immunity will be strengthened if you improve taking and basically try to take more of immune stimulants. Then some people say, try garlic, and those are just herbal stimulants to improve and strengthen immunity. Now there are some specifically made immune stimulants, which we're going to talk about in the upcoming next slides. Okay, so next one is immune suppressant. So something that will suppress the immunity. Why would we want to suppress the immunity when we have a new organ? And so that the immunity will not fight the new organ. So let's say there was a new kidney transplant, there's a new kidney. So just to reduce the fighting of that new kidney, they will just basically, what they're going to do is suppress that immunity. So some immunity is, some of those medications are called immune suppressants. So immune suppressants are used to block the normal effects of immune system. The cases of organ transplant, non-self cells are transplanted into body and destroyed by immune reactions. In autoimmune disorders, the body defense recognizes the self cell and as foreign objects and work to destroy them. Immune stimulants. So we're going to talk about immune stimulants. First is interferon. Interferon is an immune stimulant that is naturally released from human cells in response to viral invasion. Then interleukin. Interleukin are chemicals produced by T cells to communicate between leukocytes. And colony stimulating factors are used to stimulate the bone marrow to produce more WBCs in situations when WBCs are very low and the patient is at serious risk of infection. Interferons. So interferons, what is the action of interferons? They help in preventing virus particles from replication inside other cells, stimulating interferon receptor sites in non-invaded cells to produce antiviral proteins, which prevent viruses from entering the cells, inhibiting the tumor growth and replication. Pharmacokinetics. Absorbed well from the subcutaneous and intramuscular injections, broken down in liver and kidneys, excreted in the kidneys, and may be teratogenic. What is teratogenic? Something that will just, if a pregnant mother takes it, then it basically kills the new generating of the baby. So that's teratogenic. Anything that will kill the new cells, that's teratogenic. Okay, contraindications. When any medication is contraindicated when a person is allergic to it, right? So known allergies, patients are usually pre-medicated with Tylenol and Benadryl prior to administration of previous reaction. So if we know that the patient will have severe allergy, we will give them Benadryl and Tylenol so they could tolerate it. Pregnancy and lactation due to teratogenic effects are used barrier contraceptives such as condom diaphragms used to alter effects of oral contraceptives. Used in caution with a cardiac disease, myelosuppression with central nervous system dysfunction. Adverse effects. Adverse reactions are lethargy, myalgia, arthralgia, anorexia, nausea, headache, dizziness, bone marrow depression. And then also there could be other depression, suicidal ideation, photosensitivity, and with liver impairments. So we know that we always check for liver transplants, liver impairment, and also kidney. So we always check for the liver function test and kidney function test, both of them. And then we also check a CBC, which is complete blood count, to check for any bone marrow depression. What is bone marrow depression? Bone marrow depression is when the bone marrow is not able to produce enough RBC, WBC, and platelets. So when our RBCs are low, patient will suffer from anemia. When the WBCs are low, patient will suffer from low WBC and could cause infections because there's not enough WBC to fight the infection. And then there's the last one is platelets. So platelets, if there's not enough platelets, patient will have bleeding tendencies. So bone marrow depression causes a patient to have low RBC, low WBC, and low platelets. So low RBCs causes anemia. So anemia has basically your hemoglobin has the capability of carrying all that oxygen to different cells. So if you see, if you don't have enough oxygen in your cells, then a person might not be able to, they might have something called as exercise intolerance. So they're exercising, but their body cannot tolerate it, and they get tired and they get shortness of breath because they're anemic. So that is because of RBC, low RBC. Low WBC is when their WBC counts are low and they constantly catch infections. So we do neutropenic precautions for patients who have low WBC. With low RBC, we give them more red meats and vitamin C to produce more of RBC cells. So like we can improve their diet, we can give them some medications to improve the RBCs and WBC levels, and also platelets. And low platelet could cause bleeding disorders. So all of that is all that combination, all of that is called bone marrow depression, all right? So drug-to-drug interactions, so we want to make sure that we check before we give any of those medications. Interferon alpha 2b. So what is that indication? Why would you give those? Remember, we're trying to strengthen the immunity. It is usually given in hairy cell leukemia, malignant melanoma, chronic hepatitis B and C. Actions. What's the action of it? It inhibits the growth of tumor cells and enhances the immune responses. Adverse effects. What are the bad effects related with it? It could cause dizziness, confusion, rash, dry skin, anorexia, nausea, flu-like symptoms, and bone marrow suppression. Okay, interleukins. Interleukins what is action of interleukins? They communicate between lymphocytes, which stimulates the cellular immunity and inhibits the tumor growth. It increases the number of natural killer cells in lymphocytes. Pharmacokinetics, rapid distributed after injection, excreted by kidneys, and it's all of those medications are teratogenics. Contraindications, when would you not give it? Allergies, pregnancy, lactation, caution with renal, liver, and cardiovascular impairment. And adverse effects include lethargy, myalgia, arthralgia, fatigue, fever, respiratory difficulties, depression with suicidal ideation. Colony-stimulating factors. Colony-stimulating factors. Increases in the production of neutrophils in bone marrow with little effects on others' hematopoietic cells. Patients who are neutropenic are usually on these types of drugs. Actions can be used to reduce the incidence of infection in patients with bone marrow suppression, to decrease the neutropenia associated with bone marrow transplant and chemotherapy, and to help the treatment of various blood-related cancers. Colony-stimulating factors. Pharmacokinetics, they're given IV or subcutaneous. Metabolism and excretion is unknown. Then contraindications, remember, allergies, pregnancy, lactation, kidney function abnormalities, or liver function abnormalities, any radiation or chemotherapy. Adverse effects, GI-related, such as nausea, vomiting, headache, fatigue, generalized weakness, alopecia, dementia, and generalized pain and bone pain. Drug-to-drug interaction increases in the myeloproliferative effect of sargramostin when combined with lithium or corticosteroids. Colony stimulating factors. One is Neupogen. So Neupogen is, what does it do? It increases the neutrophil recovery in instances of myelosuppressive chemotherapy, leukemia, and bone marrow transplant. Give to neutropenic patients to raise the WBC count. So this is the medication that will increase the WBC production and increase the WBC count. So when a person is low in their WBC because of bone marrow depression, we give them some Neupogen. Action: increases the production of neutrophils in the bone marrow. Adverse effects: it could cause bone pain, very common, and cause impaired physical mobility. It could cause headache, fatigue, nausea, vomiting, then generalized pain. Next is Neulasta. Neulasta is it. What does it do? Another drug that increases the neutrophils. However, it is given once a week, as opposed to Neupogen, which is given 3 times a week. With Neulasta, severe bone pain is an indication of expansion of bone marrow to produce more cells. Epogen alpha, which is also called as Procrit. Procrit stimulates RBC production to counteract anemia in cancer patients. 150 units per kilogram 3 times per week on Monday, Wednesday, and Friday. Medication has serious cardiovascular effects, increases the risk of DVT in standard patients with hemoglobin higher than 11 gram per deciliter and in cancer patients with hemoglobin higher than 10 gram per deciliters. If hemoglobin is greater than 11 gram per deciliter in standard patients or greater than 10 gram per deciliter in cancer patients, hold the dose and notify the provider. So what does it mean? It means like when a person's hemoglobin is low, then only we give Epogen alpha, but if they're like a good number of 11 and above, we don't need to give it. So Epogen is for RBCs, Neupogen is for WBCs, to increase the RBC and WBC levels. Okay. Next is immune suppressants. So those are where the immune boosters, so increase immunity. Now something that will suppress the immunity. Why would we want to give the suppressants? Because the new organs could be accepted, right? So used in conjunction with corticosteroids, which blocks the inflammatory reactions and it decreases the initial damage to cells. Beneficial in organ transplant and treatment in autoimmune disease. Immune suppressant includes immune modulators, T and B cell suppressors, interleukin receptor antagonists, and monoclonal antibodies. B and T cell suppressors actions are to block antibody production by B cells, inhibit suppressors and helper T cells, and modify the release of interleukins and of T cell growth factors. Pharmacokinetics. Absorption varies based on route, metabolized in liver, excreted in urine and feces. And contraindications. All medications are contraindicated if a person's allergic to it, if they're pregnant, lactating, or having liver or kidney disorders. Adverse effects. Increases the risk of infection for all the development of neoplasm due to their blocking effect on the immune system. Hepatotoxicity, they could cause liver toxicity, kidney toxicity, renal dysfunction, and pulmonary edema. Drug-to-drug interactions. Increases the risk of toxicity if these drugs are combined with other drugs. They are hepatotoxic or nephrotoxic. Cyclosporin. Cyclosporin is most commonly used in immunosuppressants. Indication is prophylaxis for organ rejection in kidneys, liver, and heart transplant. Treatment for chronic rejection in patients previously treated with other immunosuppressants, and used to treat rheumatoid arthritis and recalcitrant psoriasis. Adverse effects include tremors, hypertension, gum hyperplasia, renal dysfunction, and bone marrow suppression. Okay, so that was pretty much all about this lecture. And so this is lecture number 1 for our immune modulators. And thank you for listening. I hope you enjoy it, listen to it. And I know these are like small lectures. These are not very long lectures, simple, small lectures. And for your own convenience, you can listen to them at your own time. You can listen to them multiple times and then do your worksheets and submit by the evening. Thank you for listening.